Hi, I'm here with Leo from the Dogface Foundation. We're here to talk to you about how can help ballers within the community. And we're going to ask some questions. So, Leo, what exactly is it that you do?
Well, I like to dox myself. My name's Rob Tardy, and for the last 10 years, I've been doing, we've been working for an advocacy group, consumer advocacy that helps veterans, disabled, Medicare, Medicaid um, people to get their benefits. This is a no-cost service, and I've yet to run into any services that we provide that has any cost at all. So it's a no-cost benefits and a no-cost service. Um, and we pretty much have like an intake questionnaire, and it pretty much tells us what benefits that you're missing and what we can do to add on them.
Okay, and so Medicaid and Medicare are primarily U.S. services. Or do you offer those services in other country help in other countries?
No, the VA, Medicare, and Medicaid, as far as the physical benefits, are U.S. based only because that's where our contracted licenses are.
Okay.
The only thing that we do internationally is mental health help. We have a hotline in pretty much every country that they can call and get mental health, no cost, over the phone, and then we can get and give them a contact number to their local VA affairs and have them call and get help in their area. But as far as us, we're only contracted and licensed in the U.S.
Okay. And now, how long have you been doing this?
I've been doing this for 10 years. Apart from Web3, I work with Phil. He's the licensed manager, and he works for an FMO. It's a group right under the government agencies that contract with them. They're self-funded because Medicare, they get their payments from Medicare, so they don't need any donations. And that's how we help out. We have our own private team for vets only in the U.S.
Okay. Now, how did you get started doing this?
I got started in Web3 um, from I used to watch a lot of gamers, like Ninja or other people that game. And then I started talking to this guy, and he says, "You ever been into into um, financial trading and all that stuff?" And I said, "Really, no." Well, he goes, "Check out, this Vaporfly company." So I'm like, "Okay." And then I checked them out on January 3, read the white paper, and got associated with them. And in a few weeks, became a guide, and got educated and upskilled by them. And then one time there was an AMA with Vaporfly from Dogface Labs, and that's how I got hooked onto them, with the benefits.
Okay, that's really cool. Now, shoot, let me grab my notes.
Okay, while you're doing that, when I was 20 years old, I contracted keratoconus, and it's a degenerated eye disease that makes your cornea stretch and cone like an ice cream cone, and it tore my cornea, so I'm all blotchy and blurry. So I became blind, pretty much legally blind.
Okay.
And then in the United States, after you're disabled for 24 calendar months, when you get your disability, you get Medicare. So that's how I got associated with Medicare. And then that was around 10 years ago. So that's when I started working for Phil and doing the vet and Medicare and Medicaid services.
Okay, now, and is the process for Medicare or Medicaid? It's kind of complicated, isn't it?
Medicaid, there's only really two ways to get Medicaid. I mean, sorry, Medicare. One is to hit 65 in the US,
Mm-hmm.
and then you get Medicare. And then, other than that, if you're between 18 and 65, if you're disabled on SSD for more than 24 calendar months, Medicare actually activates for you. And
Okay.
then anybody 17 or younger doesn't get Medicare if they're disabled. They get full Medicaid
Mm-hmm.
because they're not an adult. They're not an adult, so
Okay.
they get Medicaid. So Medicaid is just pretty much low income stuff.
Okay.
If you're low income and you really need insurance, Medicaid will help you. Uh, the numbers are quite low. Usually it's less than 1,000. per person, income each month to get Medicaid.
Mm.
It's even lower for a man because a man is, usually, the stereotypical ideas, you provide for your family, so you should be working. So usually the numbers are lower for a man, but um, and then for husband and wife, joint, the numbers are like a little higher than 1,000.
Yeah, and each state has different rules on it too, from what I understand. I know in Nevada that it's 150% of the poverty limit based on the number of people. I don't know how, uh, that applies to men, women, and children, regardless of whether you are single, married, or with kids. Um,
And a very, very long time ago, it was called welfare, and then it turned to Medicaid. That's when the states took over, even though it's a federal organization. And then food stamps became EBT pretty much.
yeah.
And then if you have kids, then you get WIC too.
Hmm. And all these services, they're really meant to be for the public good. Um,
Correct.
Sometimes they get a bad name because, like anything in the world, people want to take advantage of whatever they can get away with.
Yep. Like for an example, like asking your doctor for a handicap sticker so you can park close to the doors and you're not even handicapped.
Hmm. I know you can't disguise people's personal history other than your own, but can you give us some examples of people and types of scenarios that occur where it really benefits society for us to have these programs in place?
Yeah, the whole thing is about like there's a very wise person a long time ago wrote this in a book that that we need to take care of the widows and the orphans.
Hmm.
And I know there's a lot of orphans and widows that are multi-billionaires, but what it means is to take care of the people that can't take care of themselves.
Hmm.
And that's what it's all about, is taking care of those people that can't take care of themselves. So when you get to those people, you know, it's a blessing, what you're supposed to be doing. So that's what these organizations are built about,
Uh,
helping people that can't help for themselves.
now,
Um,
now, there's both physical and psychological disabilities that people can get help with, right?
yeah, a long time ago, pretty much insurance and Medicaid, Medicare, the VA was all about physical.
Hmm.
Then all of a sudden, with PTSD becoming a national factor in trauma, um, then all of a sudden mental health is up in the picture. So a lot of insurance companies don't have any copays for your doctor because they want preventative. They want to not cut it in the bud so that you don't have to worry about the future because we're nailing it now. Same thing as mental health. So usually there's no copays on mental health. Um, and then if a mental health person that you're really contacted with doesn't take insurance, there's always what they call the sliding rule. So they'll see what your budget is and then work with you because mental health is so. I mean, the suicide rate of vets is astronomical. It's the most with the PTSD and the because vets they come back from war and it's like some of them just aren't capable to hold a job or to provide for their family, and they struggle because they're so people of action. So mental health and discussing and like for an example, every Monday we have a mental health space on
Hmm.
X, Twitter, and
Now, what does the military do to prepare people when they're going into a war zone? Do they do anything to help psychologically prepare them?
yeah, on Discord, there's a user called Space Traveler, and he's a real life doctor with the Army in Washington. He's the head mental health physician at an army base that has over 5,000 soldiers, and they do mental health in two areas: one deployment, and then one is when they get out of the military. They have like a month or less of training how to cope with the civilian world and upskill you, to help you out, and then they have some free mental health training that the clinical psychologist, Dr. Space, He deals with them, when they get deployed.
That sounds like it might it that it's just the start for what you actually need when you're going through such a major change. Is that fairly accurate?
Oh, big time. And you mentioned the physical and the psychological. Um, in the old days, when you go see a doctor in a clinic, it was all 100% physical.
Hmm.
But now there's a lot of clinic, like for an example, I'm in Missouri in the United States, and a lot of the clinics here have two doctors full time.
Hmm.
They have a PCP, which is the physical, and then they have a mental health PCP, which and both of them are, with a lot of insurance companies, both of them are no copay or $5 or really cheap to have a co-insurance. But it's part of their clinics now, so that's to me that's so impressive. Because like look at you're in the United States, right, Brandon?
Yes.
Okay, so think of your past. Think of the majority of doctor clinics that you go to, and you would probably say that the majority of the ones that you've ever been to are pretty much physical doctors only. And it's in the olden days, it was rare to see a full time mental health doctor there, right?
I've always tended to like to stay away from doctors.
Yeah.
But I actually have bipolar and antidepressant resistant depression. So I most of my healthcare has always been therapy because it uh, having someone to talk to that's paid to literally keep your secrets and helps you process things that you're having difficulty with, I have found is one of the most invaluable things for me personally.
And you're going to find out with benefits on the administration side of it that people are going to go to the mental health clinics rather than like you going to a specialist because the insurance will cover it. If you go to a specialist, they'll cover it, but
Mm,
usually there's like a $45, $50 copay or a co-insurance. And when you go to a regular clinic
mm,
that has a regular doctor PCP and a mental health PCP, usually the insurance covers it.
no, I mean, I in December of 2022, I had two heart attacks. So
Wow.
I got to really experience what it's like dealing with specialists and other doctors, and it's a real challenge, both from the
Yeah.
doctor's side of things and the patient's side.
Yeah.
Now, what can the ballers do to help people in the community and help the foundation succeed?
The biggest thing is it's just an open door to not to advertise, but just to offer this no cost services. If any vet or any vet or any civilian that has Medicare, Medicaid, or is disabled, um, for us to help them. And you're going to find out, just not to sound negative, but you're going to find out that Medicare, Medicaid, and the VA in the U.S. Really don't talk to each other. They don't know each other's services well.
Okay.
So we run into a lot of vets that we have to activate stuff because the vets tell them, don't worry about Medicare, just go with the VA. That's not correct. You need to have both Medicare and the VA. People think, well, I'm disabled with the VA, I don't need to go to Medicare. That's incorrect.
Okay.
If you're disabled with the VA, you should be able. It's free of charge to fill out an online app, and they'll no cost. They'll send a physician in your local area, no inconvenience, and you'll get checked out and deemed Medicare, yes or no, disabled. You know, and usually the Medicare, like my Medicare disability pays 12 to 1,400, 1,400 in the higher end because of the blindness.
Okay.
But on the lower end, if it's not connected to something major, usually it's the lower end.
Okay. And you've
And then
provided.
the other way around too. So if you have a Medicare disabled person that's disabled, if you don't have Medicare, we help you, with the application and the walkthrough process, person to person. And then if you do have the VA, then our advocacy group can start the ball rolling with getting a VA doctor to be looking at you and to see if we can get disability VA. And the reason why I'm bringing that up is because, and I'm allowed to give this testimony, is there was a guy that had a lung problem with Medicare, and
Hmm.
his doctors they had no clue, what to do. So when the advocacy group found out that he had a VA, they have an intake questionnaire, like I told you before, and they asked him these questions of where were you deployed, and he said blah blah blah, as a place, and then she's like, oh, I know exactly what to do. So they contacted Medicare, and they told him the reason why he has that problem is because of this happened in that deployment. So they contacted the VA, and they got him not only, well, he was already approved with disability Medicare, but now he's approved with full 100% VA disability. That added $3,800 a month to his family.
Oh, that's amazing. I'm sure that's a real weight off his shoulders because it's hard when you're living tight.
So and Medicare and the VA, they're not going to proactively help you like that. That's why consumer advocacy groups out there are so gold mine, and they're no cost service. So if anyone's hearing this, I'd strenuously advise to create a ticket or DM me um, in the Discord. We'll help you out. I can answer any questions. We will get you help.
And
There's nothing we can't help out financially. I'll dress you to BNB. He'll help you out. I have no clue in that area, but as far as Medicare, Medicaid, VA benefits, I'm we can help you.
okay,
And but anyway, unfortunately, because of the lungs and it wasn't contacted early, the
hmm,
guy passed away. And one of the things that if you don't know this is that when a VA person passes, the benefits get transferred to his wife 50%. So when he passed a month later, his wife got 1,900, a
hmm.
month from his passing.
Oh, that's remarkable. That's a really nice benefit for people who have their spouse pass on. Um, you gave us a bunch of resources. We'll be adding it in the description in the video as well as in the Discord. We're reaching around the 20-minute mark, so I would like to. Are there any last statements you'd like to make before we close this up for the day?
Yeah, I just want to volunteer ourselves to help anyone. Any question, no problem. Sometimes my friends that are vets, I have to push them. And one guy that got pushed and got annoyed by me, hey, I saved him $120 a month, and he was glad he did it.
That's so awesome. It's really good to hear about our community helping others, and I hope a lot more people will share their stories as to what they do to help others. I thank you for your time, Leo. I hope you have a wonderful day.
Okay, be blessed, Brendan. Bye.
Bye.